For many couples who are pregnant or women who are pregnant, they or she will show up at the obstetrician and then have a series of genetic tests run to see whether or not there's a risk for the fetus that she's carrying to have a genetic disease. When couples come to an infertility program, we often try to assess that risk even before we establish a pregnancy. So preconception genetic screening can help identify patients who are carriers of genetic diseases that don't affect them, but that they could pass on and have an effect on their children. This is preconception genetic testing, which can be over several hundred different diseases. And again, since they can be silently passed from one generation to the next, family history isn't always that useful in identifying that situation. However, we do have testing now that allows us to screen for the carrier state of these genetic diseases and to find at-risk patients and whose pregnancies therefore might be affected. Once we've identified whether or not these patients are carriers, we can then subsequently do IVF with embryo testing to determine whether those embryos inherited those characteristics and to avoid embryos that might possess genetic disease.